from the News Channel 5 network. This is Urban Outlook.
Hello and welcome to Urban Outlook, a forum for African American issues. I'm April Eaton. Thank you so much for being with us today. A recent Centers for Disease Control study shows a drastic drop in the number of women getting breast exams and cervical cancer screenings. There was an 87% decrease in mammograms and an 84% drop in cervical cancer screenings or pap smears. Yet another thing to blame on the coronavirus, because you see, it turns out that people have put off routine exams in the midst of the COVID-19 pandemic, and that prolonged time between screenings threatens to increase existing health disparities. Joining us to bring light on this topic is Dr. Bernadette Meadors, a physician of obstetrics and gynecology at her practice, Heritage Women's Center. Thank you so much for joining us, Dr. Meadors.
Thank you for having me.
You've heard sort of the lay of the land, if you will, from the CDC, that we have sort of put off those routine exams, especially women, and especially African American women, it seems, because those numbers show greatly as far as Black women are concerned. Are you aware of this situation, or what are you finding in your own practice?
Yes, I would totally agree with that. And the study that you're mentioning was the National Breast and Cervical Cancer Early Detection Program, which set out to examine the impact that the COVID-19 pandemic actually had on cervical and breast cancer screening. And what it showed was, just as you mentioned, that there was a significant decrease in cervical cancer and breast cancer screening that started in March of 2020. And the study looks at a period between March and June of 2020. And as you mentioned, that there was exactly a 87% decrease in breast cancer and 83% in cervical cancer screening. And the conclusion on that was that this impact is significant overall.
And when you think about the fact that there are so many women who are diagnosed with cervical cancer, I think the American Cancer Society says 12,000 cases a year, 4,000 women die from cervical cancer. And then you look at the fact that we're putting off those very basic exams to try to make sure we prevent these kinds of things from happening. What's the impact of those delays truly on the numbers of folks who contract cervical cancer or even die from it?
You know, it's kind of hard to put it totally in perspective, but, you know, one of the things that we know is that looking at the COVID-19 pandemic is that women of color, or people of color in general, have been more impacted by COVID-19 than any other race or ethnic group. And we understand why cervical cancer screenings and prevention screenings were delayed, because so many facilities had to make changes. We had to circumvent. In my office, for example, with people themselves, with employees themselves being impacted by COVID-19, that caused us to have to make delays in opening the office. And actually between that screening time, between March and June, we actually did not do, at the recommendation of the Surgeon General, we did not do exams that were considered to be non-essential at that time, which were breast and cervical cancer screening. We continued to see obstetrical patients. We learned how to do virtual visits when we felt that that was a way of the future, but we started to do those. But that did give us some, or less an opportunity to have some hands-on intervention. And it has really brought to light, though, the impact of health disparities even further. So not only are our people highly impacted by COVID-19, now we're impacted by the delay in doing these prevention screenings, not only for breast and cervical cancer, but colorectal cancer is a huge one too. And I think that, you know, the impact of breast cancer may be a little bit different in that the incidence of breast cancer among most women is about the same, 1 in 8, when it's not genetic association. But women of color are often have more aggressive forms of breast cancer. So when you delay this impact, that becomes significant. And the same thing with cervical cancer. When you delay it, you see the impact of it being significant.
It's interesting, too, because part of the research that I've been seeing even talks about older Black women, that those numbers are even higher than others, because at some point it seems that women feel like once you get to a certain age, you don't necessarily need to do those regular checkups. Are you finding that as well, that the numbers are even higher in older Black women than younger Black women?
I think that is for several reasons. I think that historically that especially older Black women have not so much trusted the healthcare system. And now that we've encouraged them to stay home because of fear of COVID exposures, that we see it even more. So it's almost like the need to gain and regain the trust of everyone, especially older individuals. We do say that when we talk about breast cancer screening, we do recommend clinical breast exams yearly and getting a screening mammogram yearly starting at the age of 40. And breast screening doesn't necessarily have an end to it. And I usually tell patients is that end is when you decide that you would no longer intervene for the treatment of breast cancer. Cervical cancer or cervical cancer screening is recommended starting at the age of 21 and older, or those less than 60. And so over 60, you technically do not have to continue to have cervical cancer screening unless you have had a prior history of abnormal pap smears or precancer. But there is still value in getting a pelvic exam done for other reasons, especially those that may be associated with menopause. But I do think that there are several things that impact why older women may not have are getting screenings now and have not in the past been getting screenings.
Yeah, you also mentioned the fact that, we had to go virtual. And I remember having a couple of appointments with my primary care physician that were virtual. It was okay because I was just describing to him symptoms. But when you talk about a breast exam or cervical cancer screening, those, especially the cervical cancer screening, those are not things we can do at home ourselves. Now, the breast exam, we can monitor and check ourselves, right, for lumps that we may feel. But how do you help people sort of get beyond maybe the fear they still have with the pandemic still raging, and sort of make sure they either come in and get those regular checkups or do the self-exams that they can do in their own homes?
I think, education is a big key to that. And I think the virtual visits will still offer us the opportunity to really encourage education and more education. But a couple of things that I would say is that with the self-breast exam is highly encouraged. And we can teach how to do that via a virtual visit. But literature has also shown that there's been a huge impact in that as well, because again, the fear of coming in for exposure to COVID, that people that have maybe even felt a lump or have had other signs or symptoms of breast cancer have not come in for fear of exposure, to COVID-19. So not only is screening via mammograms and pap smears impacted, but patients that have actually been able to appreciate a lump or have signs or symptoms have been impacted as well and not felt a comfort level in coming in to be evaluated.
One of the senators, Amy Klobuchar, I don't know if you saw this recently, admitted that, like many, she had put off her own exam. And then when she finally got in, when she felt comfortable enough during the pandemic to get in and have her exam, she discovered that she had early stages of breast cancer, and now she is fighting that battle. So the cases of contracting things is real, right? I mean, the opportunity to keep yourself safe is even realer.
Yes. And I think that we have to find a comfort zone there. We have to reassure patients that we are using precautions, that we are masking, that we are cleaning, that we are welcoming them back to have the exams done in the office. But it takes a lot of encouragement to know that, hey, it is okay. I will say that the study that we were talking about a little bit earlier from the National Breast and Cervical Cancer Early Detection Program did show some good news, in that as of when I said that study was between May and June, it did show that as of June of 2020, screening rates were up to about 60% of where they had been. And I think that we don't know where we are now, and that literature is still coming out. And I think that is important to show that there is some improvement. But I think, again, the huge concern is that it's really brought to the forefront, again, that health disparities absolutely exist. And our population, or women of color, are heavily impacted.
Dr. Meadors, let's take a commercial break, and when we come back, I want to talk more about some of those disparities and also the impact that financial needs has on women getting these exams and going to the doctor regularly. We'll be right back after this. Stay with us.